Are you worried that you can't afford CKD treatment for your cat? You're not alone, but you do have options. Chronic kidney disease in cats comes with emotional stress, but it also comes with financial pressure. From vet visits to prescription foods to medications and supplements, the cost can absolutely feel overwhelming. In this video, I'll break down treatment costs, what's essential, what's not essential, and where you might be able to save without compromising your cat's health. Let's turn overwhelm into a plan so that you can feel in control of your cat's care and your budget. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. When your cat is diagnosed with chronic kidney disease, it is absolutely natural to want to do everything. All the things, all at once. But not every option you're going to find is equally as urgent or even important to your cat. The truth is, CKD is a long game. And just like any chronic disease, it's more manageable when you have a strategy, a plan, and you pace yourself. That's why understanding where your money can make the biggest impact can reduce stress and help to avoid emergencies. So what is essential in CKD care? Let's start with what truly makes a difference, meaning these are proven strategies. We know they help cats with chronic kidney disease, and they can make a difference in your cat's quality of life. The first one is recheck exams and lab work. These are the compass. They let you track how your cat is doing and what your next steps may be. It's possible to catch things early, hopefully before they turn into something more serious. Skipping this step is like driving with your eyes closed. However, discuss these options with your veterinarian. There's gold standard care, and then there's what can we get away with care. Gold standard care typically involves a complete blood count, a full chemistry panel with electrolytes, a blood pressure, a urinalysis, a urine protein to creatinine ratio, and depending on the circumstance, sometimes even a urine culture. While veterinarians rarely have control over the pricing of these things, they can tell you whether it's more cost effective to run complete panels or pieces of these panels. If a cat is stable and we're simply monitoring CKD, sometimes all we need are the BUN and creatinine, the phosphorus and potassium, and hematocrit value. But depending on the pricing structure of the clinic, sometimes it's less expensive to run these small mini panels versus comprehensive panels. Other clinics, it's more cost effective to run a comprehensive panel. And before anyone turns this into a price gouging conversation, as I mentioned before, veterinarians are rarely in charge of setting the prices at any clinic or hospital. There are outside lab prices and packages to factor into this. There's in-house lab equipment. Is it more expensive to run it in clinic versus sending it out? And knowing when more knowledge is beneficial versus when we can get away with a limited amount of knowledge. Always a discussion worth having when money is particularly tight. Another essential is hydration. Your cat has to stay hydrated, whether that's in the form of hydration supplements, subcutaneous fluids, fountains, all the ways that we bribe cats to drink. This is definitely an area you should focus your money on because keeping your cat hydrated makes everything else work better. A third essential is nausea and appetite management. Many cats lose interest in food, not because they're picky, but because they feel nauseous. So getting on top of this early with management strategies, with medication strategies, will help you avoid spending a lot of money in wasted foods. Addressing it early improves calorie intake, weight stability, and just the overall comfort of your cat. And then the fourth essential is phosphorus management. And sometimes this looks like feeding a low phosphorus food, whether it's a recommended prescription food or an over-the-counter one that just happens to be lower in phosphorus that your cat is willing to eat. Sometimes this looks like using a phosphate binder. Either option, or sometimes both combined, is definitely an area worth focusing your finances on. Keeping that phosphorus in check is going to extend the longevity of your kidneys, more so than a lot of other options out there. And I get it. These four areas are not flashy, they're not exciting, but they are backed by science and the response of our cats. We know they help. We know the recheck exams and lab work help. We know that hydration is a big deal. We know that managing appetite and nausea can absolutely extend your cat's lifespan, as well as managing that phosphorus intake and phosphorus blood levels. So now let's talk about what's optional that might help, but maybe won't help. And these optional things are the next step in if you can't afford these, you probably shouldn't be beating yourself up over it, and you should be focusing on those essentials. So these optionals can look like the supplements and herbs category. There is a ton of products out there. If you have spent any amount of time searching the internet, I know you have come across probably no less than 10 supplements and herbs that are out there. Some are better studied than others, some are super expensive and don't have any scientific backing, and others just are hearsay. Everybody's talking about them, but nobody really knows if they work. If you're considering the supplement and herb category, ask yourself, what is this product supposed to do? Does my cat actually need this product? And is there any version of research behind it? If the answer is, I'm not sure, that may not be a great place to invest your money. Another sometimes optional category is the alternative diets. Some cats simply will not eat the foods that we want them to eat, but eating something is way better than eating nothing. So even if it's a combination of we're going to get you to eat the diet we want 50% of the time and these alternative diets 50% of the time, great, whatever works. It comes down to we need to keep our cat eating. However, focusing your money on the foods that we can get your cat to eat and the foods we want them to eat while controlling that appetite and nausea, that's the icing on the cake. There's also specialty therapies out there. So things like acupuncture. While these may be beneficial for some cats, they can be pricey and they're not always beneficial for all cats. So again, if finances are a concern, maybe we shouldn't be looking at this option. The key is to customize your approach. Just because something exists doesn't mean it is right for your cat or that you need to spend your money there. So how do you save without sacrificing your cat's health? Well, we go back to those foundations. We want to make sure that we monitor the lab work and exams. We want to make sure that our cat's appetite is good and nausea is under control. We want to make sure they're hydrated, and we want to watch that phosphorus intake closely. Spending money on proven strategies rather than the latest, greatest thing on the market is always going to be a better bet. And talk to your veterinarian about home care. There's a lot of things that you can potentially do at home to save yourself some money. Giving subcutaneous fluids at home, monitoring your cat's weight at home. Sometimes you're able to do blood pressure measurements at home. If you're good at that, it's a much more accurate number at home than it usually is in the clinic. Ask your vet to show you how to check your cat's hydration status. All of these things can be little amounts of money that add up to big savings. And of course, reduce stress for your cat if they don't like to go to the veterinary clinic. Another way to potentially save money is to compare sources. Now, I am not a huge fan of going to the internet and buying everything and anything there. When we're talking about medications, herb supplements, you want to ensure that you are using a reputable company and a reputable site, particularly with medications. If we're looking for an online pharmacy, please have this conversation with your veterinarian. Make sure it is a pharmacy that is approved and following good standards of practice, because believe it or not, there's pharmacies out there that aren't really great quality pharmacies. I've also seen counterfeit products come through some major online retailers. The last thing you want to do is save a couple bucks, get a counterfeit product, and actually harm your cat. Quality sites, quality pharmacies have standards to uphold. There's guarantees they will uphold. Your veterinarian should be able to point you in the direction that will help you save a little bit of money, but at the same time, keep your care plan in place and your cat safe. And of course, prioritize comfort over perfection. Even though your cat has a chronic disease, you want them to have good quality of life. You want them to be doing well at home. You want to enjoy that life with them. You don't want to be spending thousands of dollars on medications, herbs, supplements, all these things that you're constantly throwing at them, only to have them hide under the bed or have them hide in the closet because they're terrified of the next thing that you're going to do to them. Honestly, sometimes less is more with these guys. You don't need to do everything. You just need to do the right things. Do them consistently and focus on, is your cat happy and doing well? And unfortunately, I do need to address preparing for the unexpected, because no matter how much we do, no matter how much we plan and create strategies, there is always the option of the unexpected. We are dealing with another living creature. As much as I wish that we could extend their lifespan forever and have complete control over everything that's going on, That's just not reality. So we do need to plan for the unexpected. Often, by the time we are dealing with a cat with chronic kidney disease, it's beyond the point of getting insurance. Now, if you had insurance prior to this, great. Take full advantage of it and use the benefits that you have. If you are looking into insurance for your cat that has now been diagnosed with chronic kidney disease, know that if you can even get coverage, it's probably going to be more pricey, and you have to do a lot of homework into what will they and what won't they cover. Because unfortunately, animal health insurance companies do the same thing they do on the human side with pre-existing conditions. Some will offer some coverage, some won't even touch it. So if you're going to go the insurance option, definitely do your homework. Know what you are paying for, know what the expectation is. And even if you have insurance, you still may want to do the planning aspect of things. So when I say that, put some money aside every month into a savings account or an account specifically dedicated to your cat, so that if we end up in that situation where they need emergency care, you've got a little bit of a buffer. You have some money set aside for that day that the unexpected happens, so that you don't have to make life decisions purely based on finances. Does it happen? Absolutely, all the time. Veterinary care is expensive. Animal care is expensive. Chronic diseases are expensive. But if you have some money set aside, oftentimes that can take off at least that immediate stress of what do I do next? It's not about expecting the worst, but it is about being prepared for when it might happen. So real talk, if you're watching this video, it means you care about your cat. You want to make good choices, and that already puts you ahead in their care. Like I said, you don't need to be perfect. You don't need to do all of the things. You don't need to be a millionaire. We need to know, where is your cat at? What are we trying to do? What are your finances going to allow us to do? And put all of that together into a care plan that works for you and your cat. So let's recap. The most important thing you want to do is focus on those foundations. If you have some money set aside after that, you can think about the alternatives, but be selective about those extras. If you're going to use them, use only what your cat actually needs. Make sure you plan ahead so that you're not caught off guard. And most importantly, make sure you are doing okay, make sure your cat is doing okay, and enjoy every day you have with them. A steady, consistent plan is going to be more important than any new shiny object that's out there that promises to cure kidney disease or whatever the ridiculous promise is. Having a plan in place is going to make you feel much more confident about their care.